Okay, good. Well, hello there. You must be... Well, it is a pleasure to finally meet you. I know we had talked a little bit virtually before coming into the clinic today. Yeah, well, why don't you take a seat, okay? Did the nurse already take some of your vitals today? Good. She's super nice, isn't she? Yes, I absolutely love her. Well, my name is Dr. ASMR, and I'm going to be the one doing your physical today. Yeah. Again, it is super nice to meet you. You know, doing things virtually isn't the same as getting it in person, so yeah, well, seeming that we're in person now, a little bit later I'll be asking if it's okay to, you know, take off my mask to see my friendly face, of course. But before doing so, I'd like to do some tests, okay, just to make sure that it is a healthy environment, okay? Yeah, so let's start by taking a temperature really quick, okay? I'm just gonna place this right on your forehead, okay? Yes. How has everything been going recently? Good, okay. Alright, perfect. Just write down your temperature. Your temperature is in a normal range, okay? We're just gonna do some of the more vital things here when we do checkups, okay? Let's start by measuring your height a little bit, okay? So if you could just stand very vertically on the wall for me today. Yeah, then I'm just gonna take this measuring tape and kind of just go down here. Yeah, and sit up really tall. Okay, and the other side here. Okay. Let's see. Alright, perfect. Very good. And then, of course, could you just step onto the scale for me, okay? These numbers, you know, aren't too important elsewise for medical purposes, so these numbers will not be released in your my chart. Yeah. Okay, let's see. Okay. Alright, very good. You can take a seat again. I'm just gonna ask you some of our medical questions, okay? Before asking you if it's okay to remove our masks, okay? Yeah. Have you been tested for COVID in the past 6 months? Okay. Have you tested positive for COVID in the last 6 months? Okay. In the past month, have you experienced a deep cough? Okay. A sore throat? Okay. Any sneezing? More than usual? Okay. Any flu-like or cold symptoms such as vomiting, achiness, rise in temperature? Okay. Any absences from work or school? Okay. Okay. And have you had any sort of flu or cold in the past 6 months? Been healthy? Well, isn't that just so special? Yeah. It's good to stay healthy. Alright, well, based on your score here, you are in the healthy range and acceptable to be taking off our masks today. Is it okay that we remove our masks so that we can get more personal in the clinic here today? Yeah, okay. As long as you are comfortable with it, I am comfortable with it. Now we can see our pearly little white teeth and our smile, so yeah. So let's continue doing some Yeah, so I'm just gonna take this, kind of warm it up a little bit before sticking it on you ice cold. Okay. Just gonna place this right here. Is that okay? Alright. Alright, take a deep breath in for me. And out. Okay. Just gonna move it. Here, same thing. Take a deep breath in and out. Okay, good. And I'm gonna come around the back side here. I'm gonna place it right on your back. Okay, good. Take a deep breath in and out. Okay. Okay, moving to the other side here. Take a deep breath in as pupil restriction and dilation. Okay, good. Just taking a look. Taking a look. Okay. Good. And could you actually follow the pen light now? Good. Just checking some of your reflexes and ability to follow and focus. Have you ever been tested for ADHD or any sort of attention disorders? Okay. For patients in your age specifically, I always recommend a mental health screening test. Okay. You do seem to be having some difficulty to the goal at the task here, okay? Might be something you would want to consider, okay? Yeah. I am gonna go ahead and just take a look inside your ears with this more close up light, okay? Just gonna take a little peek, okay, inside with this thing, okay? So, just taking a look. Just taking a look. Everything looks good on that side. Do you use Q-tips at all in your ears? So I definitely recommend that nothing smaller than your elbow goes inside of your ears, okay? You can actually push the wax deeper into your ear than you would like, and then that can cause some hearing problems. So let's go ahead and take a look at your mouth now, okay? I'm just gonna put this towel on your tongue, okay? So can you go, ah? Perfect. Just gonna press your tongue here and take a look at your mouth, okay? Good. When's the last time you saw a dentist? Good. And you get regular checkups there, too? Good. Sounds like you are quite the healthy guru. It's good. All good. I'm gonna just test some reflexes now, okay? Good. And your elbow. Good. Good. Poke. Good. Well, my dear, you are looking quite well here. Just gonna go ahead and record some of these results. Patient seems lie in the normal lanes of health. Alright, perfect. Well, I am gonna go ahead and move over my chart here to a picture of a human body, okay? You said you've had some concerns today, so we're gonna go ahead and identify them together, okay? Okay. So, we've already addressed that you would like to do some work on the sty on your eye, so I've circled the eye here. You've also said you come in with a forearm rash that roughly takes part of your forearm here. Was there any other concern you've had today? Sure. Okay, so mostly revolving around the cranium today. Okay. Okay, good. It does look like it's been a while since you've done a hearing test and a sight test. Both of those tests would be covered under your insurance, so if you would like to do that, we can do that today. Sure, let's put that there. this letter? Okay. And this one right here. I know it's super small, but try your best, okay? Okay. And what about this one? Good. And can you see this one right here? Okay. Alright, we'll stop there. Could you please cover your left eye for me? Okay. Alright. Same thing here. Could you see this letter here? Okay. And how about this one? Good. And could you read this line here, starting with this letter? Good. 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 And skipping a line here. Could you read this line for me? What was this one? Good. Okay. I'm skipping a line again. What is this letter? Good. And this letter? Good. Could you see this letter here? Very good. And what about this one? Good. And what about this one? It's a tricky one. Alright. Let's have you go to both eyes now, okay? Good. Okay. Could you see this letter here? Good. And this one? Good. 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 And what about this letter? Can you see this letter? Good. And what about these ones down here? What's this letter? I'll put this one right next to it. Good. Could you see these bottom ones at all? Okay, we'll go up one line. What is that one? Good. Okay. You see in the normal range that most people would be able to achieve. You're not supposed to get, the super tiny ones. Only the most extreme cases have been able to see that they can get that, but not even I can see that. So, alright, let's go ahead and take a look at this style, okay? You let me know if there's any sort of pain that you experience while I am touching this, okay? Alright. So, you do have oily eyelids, I do see here. So that might be causing the pores to be blocked on your eyelids here. Now, I do notice that it's not actually on the lash line, which is a bit odd. Most of the times we see cases of styes, it's going to be actually on the lash follicle, but it's actually right above. This might be needing some additional work from a dermatologist, because I do see that there's like a sac on the eyelid that needs to be permanently removed. Popping it or releasing some of that pus inside won't necessarily get rid of the styes. So, alright, let me get you a list of our dermatologists that we actually have here on staff. Yeah, of course. Some of these things are very normal, so don't feel embarrassed. Okay. So this is going to be Stacy's number. Yeah, and she is our lead dermatologist here on staff. So nervous around it. Would you happen to have eczema? No? Well, you might want to bring this to the table when you meet Dr. Stacy. I'm pretty sure that this is eczema, some sort of strain. There's multiple strains of eczema, actually. You wouldn't happen to have this sort of rash anywhere else on your body? Your fingers. Here, let's take a look. Oh, sure enough, I see it in between here. You might have a combination eczema, actually. I have that as well, where the eczema on my body is different and certain bits and things elsewhere in the body, but definitely would recommend this to Stacy when you do see her, okay? Yeah, she would be able to clinically define it as well as provide treatment of sorts. Until then, I would definitely just recommend keeping the area moisturized, okay? And taking a little exfoliant, a very gentle one, and just using it to get rid of the flakes. It helps with the itchiness as well, so yeah, of course, no problem. Well, the time has come, my dear, where I have to administer some shots to you, but these are just the recommended ones and the highly recommended ones, especially for your age group. So, did you have a preferred arm you would like me to poke today? Sure. Let's get an alcohol swab here. I'm just going to gently just wipe down the area here, okay? Are you one that's kind of nervous around needles? Blood, okay. Well, I have experienced many people that do, so what I will have you do here is just kind of turn away from the scene, okay? And I will count for you, okay? There's going to be no jump scares, no going on number 2 or 3. I will simply go on 1, counting down from 3, okay? And I will gently touch you, okay? So, let's take a deep breath together, okay? Good. Could you continue that for me while I do this? You are so strong and brave, okay? Let's do this, okay? Alright. 3, 2, 1. Relax, okay? Yep, you got it. You are so strong. Oh, almost done. Alright, good. Good. Alright, just gonna stick a band-aid on there. Good. I'm just gonna massage it a little bit just so that some soreness later won't, hurt. But, alright. So for this shot, we're gonna have you just sit here for 15 minutes just to see how your body reacts to it. Some people may experience a warm sensation, but other than that, it was super nice being able to help you today. Definitely would recommend reaching out to Dr. Sarah about your skin conditions, of course. Yeah, well, as always, stay happy.